start the recording. So good morning, everybody. My name is Emily Bands. I am joined by my colleague, Crystal Sosha, and we are going to be facilitating our fourth session of our Foundational Community Supports Golden Thread Documentation Training. And the topic for today is the Individualized Service Plan, applying the SMART framework. And thank you all so much for letting us know that you're here in the chat and for letting us know where you're from. We love to see where folks are from in Washington. And I think that's a great way to kind of connect with any colleagues that you might have out there that might be in the same county as you or in the same area as you. So I do want to just say a quick welcome. So today's webinar is hosted by DBHR through the Washington State Healthcare Authority. This is going to be an interactive training, and we encourage you to ask questions and participate throughout the session. The slides, as well as a link to the recording of this webinar, will be sent by email after the presentation. So just a few training basics. So please make sure that you are connected to audio and please make sure that you're muted. So we are not in webinar mode, we are in meeting mode. So you have the ability to unmute yourself and to also turn your camera on and off. Please feel free to keep your camera on throughout the training. We love to see faces and put faces to names. But we do ask that unless you are asking a question or making a comment, that you do keep yourself muted just to ensure that we limit any background noise. Like I said, you can choose to have your video on. If you do have your video on, make sure that your appearance and background are appropriate. Additionally, we do reserve the right to mute your video at any time, just for safety purposes if we see anything that might be concerning. To ask or respond to a question, please make sure to use the chat. And also just note that this webinar is being recorded. The recording and presentation will be sent out by the Washington Healthcare Authority. So just giving a brief overview of our training. So we are over on session 4, where we're going to be applying the SMART framework. We are a little bit over halfway through the training series, and our series will be ending on May 22nd. And just to briefly introduce myself, since I think you've primarily seen Crystal and Earl for the first 3 sessions, my name is Emily Bands. I am a lecturer here in the Department of Psychiatric Rehabilitation and Counseling Professions in the Rutgers School of Health Professions. I have been in this department for, I think, about 6 years now, but prior to that, I worked in supportive housing in New Jersey. And I have a similar role to Crystal and Earl in New Jersey, where we also facilitate training and technical assistance for supportive housing providers here in New Jersey. So last week at the end of the session, we asked for all of you to complete a learning application. And I did just want to take some moments of time just to do a brief review of the learning application. So I have a couple of questions. So my first question for all of you is, what was it like reviewing a service plan, honing in on and really focusing on those goals and objectives? So feel free to either unmute yourself or let us know in the chat what that experience was like for you. And was everybody able to review a service plan to really hone in and focus on those goals and objectives? Also recognizing that you all are very busy, so we completely understand if that was not something you guys were able to do. So just kind of give us an idea in the chat of if that was something you were able to do. No problem, Susan. Yeah, and that's totally fine, Sabrina. If you were only able to look at um, the service plans that you use in your setting. Mm. And thank you, Crystal, put the knowledge, skills, and resources form in the chat. So the reason why we asked for you to kind of take a look at the goal and the objective on the service plan is because we talked a lot about knowledge, skills, and resources last week. I know that that was a significant part of the training from last week. And in focusing on knowledge, skills, and resources, right? We know that the knowledge, skills, and resources that you identify that the person does not have are what essentially become objectives on the service plan. The knowledge, skills, and resources that the person does have are the person's strengths. Um, so, in asking you to review the service plan, focusing on the goal and objectives, what we were really hoping for you to do is to be able to identify whether or not the objective on the service plan was or is a knowledge, skill, and resource that the person needs to acquire, needs to attain, needs to learn over the course of their service plan. I'll just ask also a general question. Does anybody have any questions or concerns related to knowledge, skills, and resources? Were there any questions from that came up after the training last week on knowledge, skills, and resources in that process? And Jennifer, also awesome. It's nice to hear that this afternoon you're going to use that with your with the person that you're meeting with. That's great. All right. If there are no questions related to knowledge, skills, and resources, we'll get into the content for today. But please make sure to reach out to us if you do have any questions. So today we're going to focus more on the ISP or the individualized service plan. And we're going to focus on identifying some of those key elements of the ISP, as well as reviewing the connection between the goal, objective, and interventions of the ISP. We're also then going to focus on SMART framework, and we're going to examine the benefits of using SMART framework when developing an ISP and applying the SMART framework when developing goals and objectives on an individualized service plan. And I do want to give just a little bit of a disclaimer. I'm going to use the terminology service plan or ISP for the purpose of our conversation. But I do want to just note and recognize that that might not be what you call it at your organization and your agency. So it could be a goal plan. It could you might be using that type of terminology, but just to kind of use one succinct term to kind of talk about this, we're going to be talking about it in this reference of an individualized service plan. So, in thinking about our golden thread and kind of where we are in the golden thread, we are very much in the middle of it in terms of developing an individualized service plan. So, over the past couple of weeks, right, we focused on in session one that idea of engagement and assessing medical necessity. And then we moved into assessing strengths and needs and identifying personal goals. And now we really come into this development of the individualized service plan and really thinking about what parts, what information, what is needed in order to develop that individualized service plan. So if we're going to kind of look at this process a little bit more in depth, right, the first step is really to assess that readiness. And we want to assess readiness because that's what's really going to lead to goal identification, right? So in determining the person's readiness in order to work toward a goal, that's going to help you to kind of narrow down maybe what goal or what goals the person wants to work on. From there, you really want to look at knowledge, skills, and resources and identify the knowledge, skills, and resources that are needed to achieve the goal. And then we have the individualized service plan. And the individualized service plan is going to focus on that problem statement, which is essentially the factors that are contributing to the consumer's participation in your program. The goal, which is the person's hope or desire and should be written in SMART framework. The objectives, which are the step or steps that the person needs to take in order to achieve their goal. And again, linking back to knowledge, skills, and resources, the prioritized knowledge, skills, and resources are written in SMART framework. And then finally, those interventions. And the interventions are the services that you are providing as staff to the consumer to help them achieve their goals. So this is where you come in this service plan, is really the interventions, because those are the services that you're providing. So, in thinking about service plans and kind of what they are, one of the main purposes of a service plan is to help to integrate information about the person. So, if we're again kind of thinking about this broader golden thread of documentation, the first big piece of that is the assessment and whatever assessment that you're using. Um, and during the assessment process, we're learning about the consumer that you're working with. We're learning about your clients. We're learning about their history. We're learning about the areas in their life where maybe they're doing really, really well and they don't need as much support. We're learning about the areas in their life where they might need more support from you. And maybe more specifically, attaining knowledge, skills, and resources, right? So the plan is kind of where all this information is integrated, right? So when we're thinking about the support that the consumer needs, the service plan is the document that's going to identify those areas of needs and then identify how you as a staff person are going to help them. Again, it prioritizes their needs, right? But in addition to that, it also prioritizes their interests as well as their rehabilitation goals, right? So, when we're thinking about goals and what a goal is for a person, right? The goal is something that is going to support them maybe in their recovery, support them in integrating into the community. And typically goals are in alignment with the person and what their interests are, right? You have to have some interest in working toward the goal in order for the goal to really work out. And we'll talk about that a little bit more when we get into the SMART framework. It the service plan can also provide a strategy for managing the complex needs of an individual. Um, Sometimes, and let us know in the chat if this is something that resonates with you in the work that you do. But I know in New Jersey, when sometimes goals will focus on a person's physical health needs. Or sometimes goals will focus on financial needs, or sometimes goals will focus on their environmental wellness, right? So sometimes you might have goals for multiple different areas, and that does create some complexity, right? Because the objectives and the interventions that are also on the plan are from multiple different areas of the person's life, right? So the plan is really supporting you as a staff person as well as the consumer and being able to figure out what exactly it is they need in order to work toward these goals, and how this information can come together to support them to achieve their goal. And then goals and service plans, I should say, are fluid and inform service delivery, right? So in thinking about the fluidity of service plans, a service plan, and you might have heard this before, it's a living, breathing document, right? So it's not something that is set in stone. It's something that is changed. It's something that's updated. It's something that's reviewed. You might have one goal on a service plan for 3 months, and that might be the time frame for that goal, but it might be achieved in 1 month. Or maybe after a month, the person feels like they want to go in a different direction, and that's okay, right? So they're fluid. And again, they're this plan to support you and the consumer and understanding how they're going to work toward and achieve their goals. An ISP may also incorporate the type of practitioner providing a service, as well as diagnostic information. So at your organization, you might have to indicate what your credentials are, what your degree is, what certifications you might have. The ISP is also going to might also include the consumer's diagnosis, as that might be something necessary for the payer for Medicaid. They might want that information. You might also need to include the location of the service. So you might have to indicate whether or not the service was facilitated in the community, whether the service was facilitated at the person's apartment. If it was in the community, where specifically in the community the service took place. Was it the library? Was it their grocery store? Is it at a local park? And any other information that might be mandated by agency or state regulations. So in New Jersey, um, they're a little bit more specific about what has to be included on the service plan. So that organizations have to indicate the credentials of the person providing the service. Some agencies indicate the specific staff that's providing the service as well. So your agency and the regulations for FCS might also ask you to include additional information. So I want to just do a quick check-in. In thinking about what I've said about service plans and the information that could be included on a service plan, is this all resonating with all of you? Is this what is the information I'm talking about similar to the information that's included on the service plans that you all are developing?
Are these things like required to be on individual service plans or optional? Or does it depend on our state?
It depends on the state. It depends on your agency and your organization. Um, I think in terms of with FCS, um, your regulations are they're compared to New Jersey, I'll say, your regulations are less specific, I think. In New Jersey, we have a mandated form that the providers have to use for their service plan because our regulations are very specific in terms of what information should and should not be included. But that's very different for you guys in Washington, which is why I'm assuming you're questioning some of this, Laura, because maybe you're like, oh, this information is not on our service plan. Is that kind of what's happening?
Yeah, I'm like, and where do we find our regulations?
Um, that's a really good question. Crystal, if that's something you could take a little look at, because I don't have that information handy dandy, but Crystal will go in and she'll try to find them and so that you can share that. But I would say, or whatever your agency is doing is probably what you should be doing. And the other thing you could do, Laura, is ask. I'm always a big believer of asking questions. But agencies tend to differ. We've done this Golden Thread training multiple times in Washington. And what I've come to learn from doing this training with all of you is that your agencies are very different and do things very different. So I wouldn't be too worried, Laura, because I'm confident that if your agency isn't requiring you to do certain information, then that's probably okay. In terms of, and just to kind of acknowledge, I'm getting some yeses in the chat, so it does sound like some of this information is resonating. This is a general template of what an oh my God, and what an ISP might look like, and the different components that kind of should be involved or should be included in the ISP. So it should have a problem statement, which is the explanation of why the individual would benefit from services with examples of specific factors. So it might sound something like very simply like, consumer has a diagnosis of bipolar disorder, which is impacting their ability to manage their home, be able to work, is impacting their ability to make connections in the community. And that's why services would be helpful for them. And Erica, that's a really good point. Thank you for chiming in on that. It also might be helpful for you if any of you are having some questions to look at your agency's contract with FCS and asking your supervisor. And it looks like Crystal was able to put a link in the chat. After the problem statement, that's when you're going to get into the person's goals. So the person's goal should be written or can be written in first person with a proposed completion date. So the goal could sound like I will find an apartment over the next 6 months. Then you're going to have the objectives or those short-term goals that are going to be in SMART format. And the objective is going to look like, if the goal is for the person to find an apartment in the next 6 months, the objective might be, I will apply to 3 apartments over the next 90 days. And then those interventions are going to support the objectives. And again, the interventions are the things that you as a staff person are doing to support the person. So an intervention for that goal and objective might be that staff will meet with the client or the consumer in order to locate available apartments or available units in the community, or maybe doing some online research in order to find available units. And then you're going to indicate who is responsible for providing that intervention, the target date for the achievement, which again, over the next 6 months, et cetera, and then what the outcome is. And the outcome is going to be that the person is going to find an apartment and is going to live in their apartment. So this is just a general template. Again, your ISP template might look a little bit different than this. It might have more information, it might have less information, but these are the components to just kind of keep in mind as you're developing an ISP. Now, when we're thinking about revising and updating an ISP, you want to make sure that ISPs are revised and updated in order to stay relevant with the person's needs, their strengths, and their accomplishments. You also want to make sure that a revision occurs maybe even before it's due, right? So sometimes the person is maybe in the hospital and is then discharged from the hospital. Maybe sometimes the person is experiencing a lot of symptoms that are impacting their ability to get up, get dressed, and kind of perform daily tasks, right? So you might want to update the ISP to accommodate that as well. And before I get into revising and updating the ISP, I do just want to highlight what Crystal put in the chat. So according to WellPoint, elements of a treatment plan include goals, objectives, and action steps that include enrollee and provider responsibility and target and completion date. Goals should be done in SMART format, meaning that all goals are specific, measurable, achievable, relevant, and time bound. The enrollee strengths and barriers, members and parties of the enrollee support team, including natural supports, evidence that the enrollee is the primary author of the service care plan, such as direct quotes from the enrollee, cultural and linguistic considerations, and language that the enrollee uses and understands, clear medical necessity and reason for services and interventions, and then the dated signatures of the enrollee and the service provider. So I hope that that kind of clarifies for anybody who is having some questions about the information that should be provided. Now, when thinking about revising and updating the ISP, what is your organization's, and you can just kind of put this in the chat, but what is your organization's process for revising and updating ISPs? So that's a good question, Patrick. So an IEP is a document that is typically found in schools and in school systems. And that's the document that the school system or the teacher, the school in and of itself is using to support a child who, through their diagnosis, has accommodations to support their education. The ISP is a service plan or a treatment plan that a agency is using to support a consumer in their who's receiving services from them. So if you're working for a school, you might be facilitating IEPs as well, but a service plan is really more for like a mental health agency. Alyssa, you said, is updating an ISP, even if there is a current one, considered a billable service? That's a really great question, Alyssa. And a question that I unfortunately don't have the answer to. I don't know if anybody from FCS is on here. Oh, I think Dawn is on here. What I can do, Alyssa, is I can actually get some clarification on that. I can email our contact from Washington State and see if she can give us some clarity on that. If you want to put your email in the chat, Alyssa, I can get back to you. So Kenny, you said you normally update goals every 2 to 4 weeks. Okay, so your service plan is more of a shorter term. Nakia, you said we update goals every 6 months or when they achieve their current goals. So the service plan in of itself is for 6 months. Do you ever do like a review of the plan, like let's say at 90 days? So Daniel, you said regularly, generally speaking, during all interactions, client meetings, the stability plans drive our work. We do initial needs assessment after intake and then ongoing stability plans, updates during our time working with any given client. Yeah, okay. So at the 90-day mark, it sounds like you do a review. Okay, and Kenny, yeah, we do progress updates and updates as needed. Okay, and then when have you had to review and revise an ISP, and what was the reason for that revision? I know some people talked about like goal attainment, but have there been any other reasons for maybe having to review or revise an ISP? Okay, you said shifting goals. Absolutely right. If the person is wanting to work on something and then their goal changes, yeah, you 100%, you got to update it. Melanie, changing coverage or care. Lori, when we do the research, we do go over the ISP after hospitalization. Akoya, I hope I said that correctly. Client choice, if their goals change and they report it to us. Kenny, life changes, direction changes. Oh, cool. Thank you, Akoya. I'm happy I got that right. As goals are achieved. Yeah, so generally speaking, and it also sounds like you all are updating your service plans more often than we do in New Jersey. It sounds like the process at your agencies is very much in alignment with that idea that the service plan is a living and breathing document, right? So you want to make updates to it as needed, as necessary, when it's possible, depending on what the person's needs are. And that is really best practice. It sounds like you guys are doing best practice, which is good because you want to make sure that the plan is in alignment with what the person is wanting to work toward. And as we know, we're all humans, right? I don't know about any of you out there, but I've wanted to work on a goal one week, and then the next week I'm like, I don't know if I really want to work on this anymore. Right? So it is important to just be mindful of that and to treat this as a living, breathing document, as you guys are. And that's great. So, Lori, you asked, is updating an ISP billable? So somebody else asked that question as well, and we got some feedback in the chat that it should be, but I am unfortunately not the best person to answer that question. But if you also put your email in the chat, I will get a definitive answer. The other thing we could do is once I get a definitive answer, we can also just share it next week. So everybody will have that answer next week. So in terms of the goal, objective, and intervention, right, I just want to give a brief overview of what these three components of the ISP are. Because even though there's a lot of important information that is included on the ISP, the goal, objective, and the intervention, I would say, are the biggest aspects of it. So Angela, if you could put in the chat what you mean when you say GASP or HAP, because I'm not familiar with those acronyms, I could let you know if it is or isn't the same. I'm just not sure what that acronym is. So when we're thinking of the goal is the larger goal that the person wants to achieve. So goals are typically things that people are looking to work on, to change about their life over a longer period of time. And you typically know that something is a goal if it's almost like the end game of what the person wants. And I say that because the objectives are the steps that a person is going to take to achieve their goal. And sometimes when we've looked at goals, objectives, and interventions, sometimes an objective will end up being a goal. But we know that, but what ends up happening when an objective ends up as a goal, it's typically a step towards something else. So, for example, if I won't use the same example I used before, but let's say the person wants to, walk in the park 3 times a week. You might think of that as their goal, but after having more of a conversation with the person, you find out that there's a reason why they want to walk in the park 3 times a week. And it's because walking in the park 3 times a week is something that helps them to feel calm. It's something that helps with their mental health symptoms. It's something that helps them to manage their depression better. So now we know that that walking in the park 3 times a week is actually a step for them to do something else. And that something else is for them to better manage their mental health, we'll say generally, right? So better managing their mental health is actually the goal. Their objective is to walk in the park 3 times a week because that's going to lead to them being able to better manage their mental health. So I hope that that kind of makes sense. And then the intervention is what you're going to do. So the goal and the objective are what the consumer or their client is going to do. It's their responsibility. It's how they are participating in this plan. And the intervention is what you're going to do. So the intervention really focuses on what staff will do to help the person achieve their goal. It should be specific, it should be clear, and it should relate back to the objective. And you can have more than 3 interventions, but you also want to be mindful of how reasonable that is. When I say that you want to make sure it relates back to the objective, if the person's goal is to better manage their mental health, and the objective is for the person to walk in the park 3 times a week, it probably doesn't make sense for the intervention to be about teaching budgeting skills, right? That doesn't make sense. That really doesn't relate back. So you want to make sure that the intervention does link back to the goal and the objective, and that there's a clear thread there as well. So it looks like, going back to what you said, Angela. So you said HAP is a housing action plan. Kim, you said goal and service planner. Yeah, so I would say that those are your agency's goal plans. So when I say ISP, I am 100% talking about that. I hope that that clarifies. Absolutely. All right, so this is kind of what we have for the, generally speaking, information related to service plans. We're going to transition now into the SMART framework. So before I transition into the SMART framework, does anybody have any questions, any other questions about service plans, about service planning, any other questions? All right. So let's transition into SMART framework. And my question for you is, what do you all know about SMART framework? Does that sound familiar? Does that sound unfamiliar to you? Do you know what I mean when I say SMART framework? All right, cool. It's sounding familiar to Susan. Anybody else is familiar with SMART framework? Okay. All right, so I'm getting some familiars. So for those of you who are saying it's familiar, this is probably going to be a review. So bear with me. But I do want to ask that as I am reviewing, even if you are familiar with it, that you do take into consideration what I'm going to say, especially if you do have some difficulties with implementing SMART framework, because I hope the way that I explain it to you is going to be helpful to you in being able to implement the SMART framework when you're developing goals. So what we are going to do is I'm going to give a overview of what the SMART framework is. Oh, you know what? Kedron, I'm sorry. I've heard of that also. Smarty with adding the inclusive and the equitable. But it's I like that, Tetra. Okay, thank you for clarifying that. I have heard of that also, but because your regulations don't include the SMART E into it, that's why we don't train on it. But thank you for bringing that into the conversation. So in thinking about the SMART framework, we are talking about specific, measurable, attainable, relevant, and time-bound. Now, I know WellPoint talks about this in a little bit of a different way. They look at it as achievable and relevant as opposed to attainable and relevant. At the end of the day, the A, the letters, there are many different words that are in alignment with the letters of the SMART framework. We've also seen realistic instead of relevant. Like I said, achievable instead of attainable. But we talk about attainability for a very specific way. So I'm just going to ask that you hear me out when I talk about the attainability. But essentially, SMART framework focuses on a goal and an objective being specific, measurable, attainable, relevant, and time bound. Now, for specific, we mean exactly what you want to happen. So it should be clear. It should really paint a clear picture about what the goal is. In terms of measurability, it should measure and evaluate progress and or any barriers that might occur. In terms of attainability, it should require effort, but also within reason. In terms of relevant, it should be consistent with other goals and require some commitment. And in terms of time bound, there should be a clear time frame for evaluation. So when we're thinking about specificity and a goal being specific, we want to make sure that goals are as specific as possible, stating what you want your result to be in concise words. A good goal statement explains the what, the why, the who, the where, and the when of a goal. If the goal statement is vague, it's going to be difficult to achieve because it's going to be difficult to know what you're working toward and when you've essentially gotten there. You'll get this the slide handout, Erica. So if we think of a common goal, which is to be happy, that is something that is very much too general, right? That could mean like a million different things, right? There's so many ways to be happy. So what we would want to do is we want to break that down into something easier. So what we're going to do is we're actually going to go through the SMART framework together. And we are going to pick a goal that we're going to work on. So I just put 3 options in the chat, and I want you all to let me know in the chat which one do you think we want to work on. So either we can improve our happiness by becoming employed, we can improve our happiness by making new friends, or we can improve our happiness by learning coping skills. Which goal do we want to work on? What do we think? So it looks like we're doing coping skills because that is the overwhelming response in the chat. All right, so let's focus on coping skills. So right now, our goal to make it a little bit more specific, right? We went from I want to be happy to I want to improve my happiness by learning coping skills. Okay, that's how we're getting a little bit more specific. Now we have to make this goal measurable. Okay, so when we're thinking about measurability, we want to include some type of unit of measure in our goal. So we want to be objective rather than subjective. So when exactly is our goal going to be achieved? How will I know that it has been achieved? We want to be able to track progress and measure the results of our work. So how can we make our goal more measurable? So right now our goal is to improve happiness by learning coping skills. How can we make this more measurable? All right, so Susan, you're on the right track. You said I will learn and practice 2 new skills in the next month. That's definitely measurable. Teresa, you're also on the right track. Identifying a specific coping skill that maybe they want to work on. Um, maybe Danielle, you're on the right track also. So maybe practicing coping skills. So Jennifer, you gave us a couple of different options in terms of uh, researching skills, creating a list, using a skill. So I think we're going to go with what Shannon said because you put it in a nice little bow the way you worded it. So I will learn and practice 2 coping skills in the next week to help with my happiness. Actually, let's say in the next well, let's make this goal a little bit more um more of a longer term goal. So we'll say the next 3 months. So we're going to learn and practice 2 coping skills in the next 3 months to help with happiness. Now, again, we're thinking about this as a goal, right? So we're making this something that is longer term. So for you, Kenny, that sounds more like an objective. That sounds like by learning this new coping skill from that resource by the end of the week and attempting to implement it, then reviewing how well it worked, that is a objective that's going to help us achieve this goal of learning and practicing 2 coping skills in the next 3 months, right? That is a step that we're going to take in order to work toward that goal. Exactly. So that's why we want to be mindful of there being a differentiation between those goals and objectives. The goal is definitely something that's going to be a little bit more long term. Okay. But we made our goal measurable. So let's get to attainability. So we focus on this idea of attainability because we want to make sure that the goal is feasible in terms of resources that are available to you. Okay. The term attainable stresses the importance of goals that require effort, but are still within reach. While it may be a stretch to accomplish the goal, it need not be extreme. So when we're thinking about attainability, we're really focusing on the knowledge, skills, and resources that the person needs to have in order to attain that goal, and whether or not they can acquire those knowledge, skills, and resources. So the example that I like to use for this is I had a consumer that I was working with many, many, many years ago that wanted to become a CDL truck driver. That was his goal. But he was unable to pass the background check in order to do so. So there was no amount of knowledge, skills, and resources that he was going to be able to acquire in order for him to, he needed to pass the background check and he was unable to. So essentially and unfortunately, this goal was unattainable to him because there was no way he was going to be able to pass that background check and be able to work at any CDL driving company, right? It wasn't going to work. So when we're thinking about attainability, right, we're really thinking about the knowledge, skills, and resources that the person needs and whether or not they can actually acquire those knowledge, skills, and resources in order to work toward that goal. And I would say a lot of the time you can, right? A lot of the time you can teach people skills. A lot of the times you can provide them resources in order to attain their goals. There's so many accommodations and support out there for folks that a lot of the times the goal is going to be attainable, but sometimes it isn't. So just being mindful of that. Now, when we're thinking about whether or not this goal is attainable. We're really going to focus on the measurability, only because we don't have a client in front of us to know whether or not this goal is actually attainable, right? But if we think about being able to learn and practice 2 coping skills in the next 3 months, does that sound attainable to everybody? Generally speaking, what do we think? Is this attainable? Yeah, I would agree. I think we are on the right track. All right. So let's go to relevant. So R stands for relevant, meaning, and yes, absolutely, Okoye, right? It is really important to note that each client's definition of attainable may vary. What's attainable to me might not be attainable to you. And also, it depends on what the specific goal is, right? You might have someone that you're working with that wants to find a job. And you might have clients that have a lot of work history, and have a lot of work experience, and they're going to be able to maybe find a job in 3 months. Where you might have someone else who needs a little bit more support, who is going to need that 6 months or a year to find a job, right? So it is very much based on the person that you're working with. So thank you. So R stands for relevant, meaning that the goal should be compatible with a person's lifestyle and other interests, like their current environment, their valued life roles, and their existing priorities. Actions required to achieve the goal are within your control, something that you are willing, able, and motivated to work toward. A relevant goal will usually answer the question, is this worthwhile in my life? So when we're thinking about relevancy, we're really thinking about what the person's motivation is to work toward the goal. Do they want to work toward the goal? Are they able to work toward the goal? And is it something that is actually going to be worth it to them? So let's think about our goals so far. Does it seem relevant to you? Does it seem relevant to um, learn and practice 2 coping skills in the next 3 months to help with happiness? Do you think that this could potentially be relevant for somebody? Mm. Absolutely. Yeah. Mm. And in thinking about relevancy, right, I do want to hone back in on um, our what I was saying about motivation, right? And really thinking about assessing the person's motivation and their readiness toward working towards a goal. So, Jennifer, you said I have a client who set a goal of gaining confidence, and we came up with these steps. Clients will practice positive self talk and journal accomplishments, set small, realistic goals, and participate in group activities or peer support. Case manager will offer encouragement, positive feedback, refer to appropriate therapeutic services, help client check progress, and celebrate milestones. Is that too broad? It doesn't sound too broad to like in terms of the goal being to gain confidence. Mm. I guess the only question I have in terms of that being a goal of gaining confidence is how do you measure that? How will the client know that they have gained confidence? What's going to change for them? Yeah. So that's just something to think about. in terms of measurability. Well, so with the journaling and the regular check-ins, right? And thank you, Crystal, right? So what's going to happen at each check-in? What's going to tell the client that they are more confident? How is their confidence impacting their life now currently? And Kim, you put in a good example, right? So maybe they're unable to answer the phone at work without panicking, right? So currently they're at work and every time they have to answer the phone, they start to become flustered. That's now going to change once they gain more confidence. Or maybe it's about being able to talk to a stranger on the street. Or maybe it's about joining a group. And yeah, that's a great point also, Shannon, right? So maybe doing some type of self-esteem questionnaire or check in that way using some type of scaling, right? So asking the person, um, at day one, when they're working on the goal, what their self-esteem is. And if they're saying it's a 1, but by the end of that time frame, they're at a 5, that's going to be a good way to gauge. And yeah, that's a great suggestion also, Crystal, having them conceptualize and define confidence in their own words. I hope this is helpful, Jennifer. Awesome. All right, so let's do the last aspect of SMART, which is time bound. So T stands for time bound, meaning the goal should have a deadline. So a good goal statement is going to answer that question, when will I achieve my goal? And you want to make sure that you include a time frame, such as a week, a month, or a year, and include a specific date if possible. Without time limits, it's really easy to put goals off and leave them to disappear. So what are some ways we can make our goal time bound? So again, this is our goal. I will learn and practice 2 coping skills in the next 3 months to help with my happiness. How can we make this more um, uh, time bound? What's a good time frame to add to this goal? So yeah, absolutely, we could do check-ins. Um, right, that's where that review and that revision comes in. But how long do we think it would take? Oh, I like that, Susan, right? By a birthday, or some event coming up. I like that. So it sounds like maybe we're looking at I will learn and practice 2 coping skills to help with my happiness by my birthday. So yeah, always having those check-in points with the length of the deadline. Kim, you said I will research coping skills by this date. I will implement one of those skills and practice it by that date. Those sound like really great objectives, right? Those are the steps that you're going to take in order to achieve that goal. And yeah, making sure you're checking in at every meeting to see if they have made progress. Yeah. So I hope that this was for those of you who said that this was going to be more of a review. I hope that um, this information was helpful, and I appreciate your patience as we did review this information. For those of you who are maybe unfamiliar with the SMART framework, I hope that this was helpful in being able to understand better what the SMART framework is and how it's used when developing goals for a service plan. What we're going to do is we're going to transition into our break. So we're going to take about 5 minutes, and then we will see you back in about 5 minutes for the rest of our session, okay? And I will get to those questions in the chat after the break. So we'll be back at 10:40. Thank you. I'm just starting the recording back up. So in the first half of, or in the first part of our session, I'll say, right, we talked about the ISP. We really honed in on those SMART goals, right? We went through the SMART process. So now we're going to do an activity. So this is going to be a timely activity, I'll say, that has a couple of pieces and parts to it. So I'm going to put the activity directions in the chat box. I'm going to ask for you to take a look at them because there are a couple of documents that go with this activity. So the first part of this activity is our client, okay? So we're going to be working with Samantha, who's a 66-year-old female who has been diagnosed with depression and anxiety since her mid-20s. Samantha has lived with her husband. However, he recently passed away, leaving Samantha unable to independently pay for her rent. Samantha has a 28-year-old daughter who's supportive of her, but is unable to assist Samantha with housing. Samantha is still dealing with the grief of losing her husband and finds the process of moving daunting. Her symptoms of anxiety and depression have recently increased. Now, we did an assessment with Samantha, okay? And we're not going to go into breakout groups, guys, so don't worry. We're going to do this as a large group. So we met with Samantha, and we did an assessment. And these were the most important parts of the assessment, okay? So the three areas that really stood out to us when we did the assessment were her environmental housing, emotional mental health, and financial wellness. And as you can see, Samantha noted a 2 for her environmental housing wellness. And she noted that she's currently at a 2 since she can no longer afford to pay for her apartment on her own, as her income is not enough to support her $1,700 a month rent. In order to move from a 2 to a 3, Samantha reports that she will need to downsize to find a studio or a smaller one-bedroom apartment for less than $1,100 per month. For her emotional and mental health wellness, She stated that she's at a 2 because she is still dealing with the sudden death of her husband, in addition to the stress of having to find a new apartment and move. She reports that in order to move to a 3, she would like to find a new apartment and move as quickly and simply as possible in order to reduce her stress level. The other area of note from the assessment was her financial wellness. And Samantha noted that she's at a 3, and that although she will claim her husband's Social Security benefits, her husband was continuing to do electrical work as he was a licensed electrician on the side to supplement their income. So she reports that this extra income gave them enough to pay their rent, as well as debts they were still paying off, that she will now be responsible for paying on her own. So, in order to stay at a 3, she will need to downsize to a smaller 1-bedroom or to a studio apartment in order to make up for her husband's extra income. So, that's really why she has to move, is to ensure that they have enough money to kind of pay off some of these debts that she has. And then we also have a knowledge, skills, and resources form that we did with Samantha. So, her goal is to find a new apartment. And she noted that she needs some help with purchasing moving supplies. She needs some help with managing stress caused by moving. She knows the price range she needs to stay within. She knows where she wants to live. It also sounds like she needs some help with researching an apartment, filling out applications, and coping with her stress. She knows where to purchase moving supplies or how to purchase moving supplies, and she knows how to organize the move. And then it also sounds like she needs some resources. So she needs moving supply stuff. She needs a moving company. She needs help moving, but she has all the necessary documents for apartment applications. Okay. So all this information is in the link that I put in the chat box. And I'm going to put that back in the chat again. So what we're going to do is we are going to make her goal SMART, and then we're going to come up with 3 objectives. So let's start with the goal, right? Right now, her goal is to find a new apartment. How can we make this goal measurable? What do we need to add on to this goal to make it measurable? I like that, Kim. You said I will find a new apartment within my price range. So we know that for Samantha, that's $1,100. Or we could say in the area she wants to live in. Absolutely. What else? Who else has some suggestions? So Heather, you're getting a little too into kind of some of those interventions, so we're not there yet. Jennifer, you said I will find a new apartment in my price range by New Year's Day. And you also have a the time bound, the timeliness of it also. Susan, you said I will sign a lease for an apartment by the 1st of the month. Jeannie, you're also getting a little bit into the intervention, so we're not quite there yet. So we know, Melanie, that she can afford $1,100. So why don't we go with that? Let's start there. We'll say, I will find an apartment under $1,100. So Kim, that sounds more like an objective. So we're not quite there yet. Let's just focus on the goal. So her goal is to find an apartment under $1,100. We know that that's attainable to her, right? Because we know that that's what her budget is. We also know that that's relevant, right? Because we know that she wants to find and she needs to, right? She really doesn't have a choice. She has to find a new apartment. So then we really just need to make this time bound. So I like what Jennifer said about New Year's Day. So let's go with that. So Richard, you actually have a couple of goals here, right? So one goal would be to find an apartment within budget within a couple of weeks. And then another goal would be to fill out the application. Or that filling out the application could be a part of it. We'll also make this goal a little bit more specific, right? Because we'll say that she'll move. Let's say this. This is a SMART goal, right? I will move into an apartment with rent under $1,100 by New Year's Day, right? We know that it's specific enough. She's going to move into that apartment. We have some aspect of measurability because it's under that $1,100, and we have a time frame because it's going to be by New Year's Day. And Lori, these are good questions, right? Once we get to this identification process, right? So now that we have the SMART goal, now we can get to some objectives, right? And thinking about how she's going to achieve that goal. Okay. So Jeannie, that's a really good question. When looking at the KSR, we didn't note on there about the deposit and the holding fee. I think it's safe to assume for Samantha she has those things. We'll say for the purpose of this activity she does. So we know from her knowledge, skills, and resources, right? Then, and thinking about how we're going to use this knowledge, skill, and resource form in order to inform our service plan, right? If we look at these two columns here and this column here, this is where we really want to focus on developing some of these objectives, right? Because these are the areas of need. So we know that she needs to manage her stress. She said that twice here. It sounds like she needs to purchase some things and hire a moving company. It sounds like she needs some help with researching apartments and filling out applications. What are some objectives that we could put on this plan? What are some steps that she needs to take in order to work toward her goal? So Akoya, you're on the right track, researching affordable movers. Absolutely. And Alma, you're right on that track as well. So hiring a mover. So let's say hiring a moving company. So that could potentially be one objective. What are two other objectives? And if anybody has affordable moving or moving company resources in Washington State, make sure to put them in the chat. So Alyssa, that's a good question, or Elisa, that's a good question. She might need a storage unit. So that could potentially be something that could come up. So we know that she needs to hire a moving company. It does look like she needs help moving, Jeannie, because she noted that on the knowledge, skills, and resources. But we already have the moving company figured out. And we're going to assume that Samantha has money to get one of those moving companies that will also pack everything up and do it for her. So let's focus on what other areas of support Samantha needs, right? So there's some other things on this knowledge, skills, and resources form. Stress and kind of coping with this stress is something that she highlighted a couple of times on the knowledge, skills, and resources form. What is an objective that we could add to the plan around stress? We had a couple of things coming through the chat. So see if there are resources to help manage mental health and grief. Adding a self-care component at the end of each day, working with FCS provider to research coping skills for the grieving process and to help with stress, help her gather information needed on applications to reduce her stress. So Jeannie, I like that. It's kind of like a twofold kind of thing. For the stress coping, it would be good to figure out her support network who might be able to assist with stress management, like set aside a day of the week to spend time with a friend. Okay. So it sounds like we're looking at stress from like two different angles in the sense of how to kind of reduce some of the mental weight and kind of mental load of this moving process, in addition to kind of the self-care and maybe like relying on social supports. And yeah, absolutely, Carrie, right? Coping versus what is causing the stress. So how could we word this into an objective? How might we word that? I like that, Quinn, right? So client will allocate time at least once a week to visit a friend to increase social circle and reduce stress. Yeah, absolutely. And it's also pretty much in smart format at this point, right? So we have that time frame, right? We know it's going to happen once a week. Um, well, no, so the time frame would, I guess, be we'll say until New Year's Day, because that's that time frame that we have. But we have that measurability of once a week, right? Because we know that she achieved this objective if she went to see her friend once a week. And if she wasn't able to see her friend once a week, then we know she didn't achieve this objective. So that's perfect. Kim, that's also a great one, right? Finding and attending a grief support group within 3 weeks. Um, that's also 100% on point. Um, I will find and attend. Yeah, that's great. And that addresses the grief, right? Because we know that even though the moving aspect of this is very stressful, she's still grieving, right? She still lost her husband. Her life is changing. This is a really big adjustment period for her as well. So I want to go back to our first objective that we have, because we never made that smart. And let's see if we can make this into more of a smart format, and then we'll determine what our last objective will be. And yes, absolutely, Kim, right? That'll also address the socialization aspect, because now she's making friends and kind of being around other people who've lost a loved one. So how can we make this objective of hiring a moving company smart? I would say it's pretty specific. But how can maybe we make it more specific? How can we make it measurable? And how can we make it time bound? So, Kay, you said I will call and get a quote from 3 moving companies by the end of the week. Yeah, that's great. So we know it's measurable because we are calling and getting the quote. If we don't call or if we don't get those quotes from all 3 moving companies, then we know that we have not met that objective. It also has that time frame because it's by the end of the week. Kim, you said I will find a reasonably priced moving company with good reviews who have time available by the end of 2 weeks. So your time frame is a little bit longer. And yours is a little bit more specific because we're focusing on somebody that's reasonably priced, who also has good reviews, right? Because we want to be able to trust them. And what I like about yours, Kim, and yours, Kay, is that you both are saying the same thing, but you just said it a little bit differently, right? And I want to highlight that because there are a lot of right ways to do things. There are definitely a lot of wrong ways to do things, or there are some wrong ways to do things, but there are a lot of right ways to do things. And what it really comes down to is the person that you're working with and what's going to make the most sense for them. So we have the moving figured out. Oh, and Jeannie, you said most movie companies need to know the approximate number of boxes, large furniture that will need to be moved, working with the client to make a list. Yeah, that would be a really great intervention for that, right? Because that's what you're going to do as the staff person to support Samantha and being able to reach that objective. Absolutely. So we have the stress managed and kind of figured out. We have the moving aspect of it. Um, We know that the goal is to move into the apartment. What else do we need to do in order to help? What's another objective that we need in order to help Samantha move into an apartment? We have moving figured out, we have stress figured out. What's left? She might need to clean. Cleaning and kind of organizing. Well, it sounds like she already knows the organizing stuff. Cam, you said service hookup in a new apartment. But have we helped Samantha find a new apartment? So, Jennifer, you're on the money. So, you said I will research and contact 3 potential listings per week, setting aside time each evening to browse listings and schedule viewings, and will sign a lease and move into a new apartment by August 1st. Okoye said reaching out to landlords, elderly properties, and housing authorities to find resources. Yeah. On the money. Right? We got to help her find the apartment. So, Jennifer, because you again tied this up nicely into a bow. So, Paula, this would be a really good intervention for this objective. Um, so, first, focusing on the objective. Um, it sounds like this would probably be better broken down into 2 objectives. So, the first objective. Oh, so the first objective would probably be to research and contact 3 potential listings a week until August 1st. That's a really good objective. And to your point, Paula, asking her what she wants and needs in the apartment is something that's going to help Samantha to achieve that objective of finding a new apartment, right? Because she's got to be able to identify um, what her wants and needs are, right? Maybe she's 66. Maybe she doesn't want to be on a second floor anymore. Maybe she wants to be on the lower level. Or maybe she doesn't want to be on the lower level. Maybe she wants to be on the 8th floor and wants to be up higher. Maybe she wants a balcony, right? So we want to help her kind of figure out some of those wants and needs. And yet, figure out the subsidy is also something that's a part of that. So I think the second objective would be so maybe it might sound something like completing the application and all necessary paperwork, including that subsidy paperwork, by New Year's Day. And I only suggest kind of breaking it out because you also want to make sure that when we're developing like goals and objectives, sometimes it can feel overwhelming for folks if there's a lot in a goal or an objective. it might feel a little bit less overwhelming to break things down a little bit more, right? So instead of it being having to locate units and then apply and then move in, that can feel like a lot. But if we kind of break it down into, okay, I'm going to take time within this time frame over, a 4-week time frame, I'm going to research. That feels a little bit more digestible to then, once you achieve that step, to go to the next step, which is to now apply and fill out the paperwork and do all those things. And yeah, absolutely, Kim, right? So steps are easier to achieve and feel confident about, and you check it off the list. Yeah, absolutely. And again, like sometimes it might only take 1 or 2 weeks to, um, achieve a step, but that's why it's really helpful to kind of keep the service plan as this living, breathing document, because then we're updating it anyway, right? We know that we're going to update it anyway. We know that it's going to be easy to kind of take any thing that has been achieved off of the service plan. And then the last piece of this, which maybe we should have done first, but we kind of got into the goal and the objectives, is to coming up with that problem statement, right? Oh, no problem, Kim. Thank you. So when thinking about the problem statement, and I'm gonna go back to the slide because that was a little bit earlier in the training. The problem statement is that explanation of why the individual would benefit from services with examples of specific factors. So what is the problem statement for Samantha? What is the justification for Samantha receiving services from us? What do you guys think? It's okay. You said she's been diagnosed with depression and anxiety, and since her husband passed away, she's unable to make ends meet. Jeannie, she needs help to ID apartments in her price range and help to prepare for a move. Having an apartment will give her peace of mind, relieve the stress of not having a place to lay her head. Absolutely. So, kind of combining all those things, um, it sounds like the problem statement would be something like Samantha would benefit from services due to the recent passing of her husband. Since her husband's passing, apartment. This is what I came up with, which I think is a good summary of what some of you all are saying, right? So Samantha would benefit from services due to the recent passing of her husband. Since her husband's passing, she's no longer able to afford her apartment, and would benefit from help with finding a new home to decrease symptoms of her depression. I think that kind of summarizes it. And then we know that her goal is, we identified this as her goal. And then her objectives are to in no particular order. These are the objectives that we came up with. And I would say this is a pretty good service plan, right? So we have the problem statement. Samantha would benefit from services due to the recent passing of her husband. Since her husband's passing, she's no longer able to afford her apartment and would benefit from help finding a new home to decrease symptoms of her depression. Her goal is to move into an apartment with rent of under $1,100 by New Year's Day. And her objectives, right? So the steps that she's going to take in order to achieve that goal is to research and contact 3 potential listings per week by August 1st. She will then complete an application and all necessary paperwork for her chosen apartment by New Year's Day. She will call and get a quote from 3 moving companies by the end of the week. And then she will allocate time at least once a week to visit a friend to increase her social circle and reduce stress until New Year's Day. And that could be absolutely, Alma, that could be a additional intervention or objective, I should say. So I want to ask generally, does this process make sense in terms of identifying that problem statement, using all of these documents, right? Knowing the background information that we have, looking at the assessment, looking at the knowledge, skills, and resources form. Does all of this, does it make sense how all this information then funnels into that ISP development? And you could just give me a yes or no in the chat box. Does anybody have any questions about this process? And is this process similar to the process you all are currently participating in as you support individuals in developing their ISP goals or their service plan or treatment goals? Is it similar? Is it different? I hope it's similar. And if it was a little bit different, I hope that it was different in a good way, that maybe there's something that you can take away from this that you can now use in your process. All right, good. And yes, it was very much more thorough. I definitely think we probably took a lot more time on identifying the goals and the objectives and making them smart than you all might. But that was also very purposeful for training purposes, right? Obviously, when you're in the community and you're meeting with people, you don't have time to spend like 45 minutes on this, and we totally get that. But just trying to, for training purposes, really hone in on some of those details. I hope that that was helpful. All right, so thank you guys so much for the feedback. Um, just as a reminder, next week on the 15th is our next training. It's going to be on ISP intervention development. We are going to ask for you to participate in a learning application. So what we want you to do is we want you to just review one of the ISPs you currently have. And again, focus on the goal and objectives and think about whether or not the goals and objectives are in SMART format. And if they are in SMART format, think about, is there specificity? Is there a way to measure progress? Is it attainable and relevant? And is it time bound? Yes. Yes, Erica, we are in May. So yes, we are going to be here. I take it that you were confusing April and May, but you do have the Zoom link. It's the same link for every week. So you could also just use the same link as you used for today. So Laura, I think the recordings for the first couple of sessions did go out, but there is a little bit of a lag. I will say that. What I will do is I will ask for it to be sent out like one final time at the end. I'll ask our friends at Washington to do that. But I do believe that at some point last week, the first two I think did go out. I'm not sure if the third went out yet. And we're on number 4. And Crystal also put the evaluation in the chat box. Please feel free to do the evaluation. We do love your feedback. We are always happy to receive your feedback. Crystal put the link in the chat again. But if there are no other questions, I am going to stop the recording.